Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Linsman. My guest on the podcast today is Erin Muck. Erin is the President and CEO of Crawford County Memorial Hospital. And Erin, thank you for joining me today.
Well, Happy New Year.
We have a number of things we're going to talk about because it is the end of one year, the beginning of another, and this is usually the time that we get together and we do a quick update and post that so that people know what we have going on.
Yeah.
And we've got a lot going on. So let's start at the beginning and just talk a little bit about the construction project. We've made great progress, but I know there's more yet to come.
Yeah. We are, I mean, you can see if you drive by that there is a lot going on outside. Before in the beginning it was a little, you're not really seeing anything because it's happening behind the scenes and underground. But now you'll start seeing some walls going up. You can see all the steel going up, and so that's exciting. We had a beam signing that we just did a few weeks ago, and so that was really cool for staff to be a part of history. And so we'll start seeing that come along. I think that it's moving a lot faster than we thought it would be.
Yeah, and even in spite of the fact that we've got some snow and cold weather because it's January, I anticipate that we will continue to see progress continue.
Oh, of course. And they're out there every day doing things. I've driven up here on a Saturday and they're putting steel up, and it was kind of surprising, but good on them. So they're moving along, and we really hope that our phase one will be completed by February of 26. So this fast year will happen, and that's only 14 months away if you think about it. So at that time we'll be able to move into our rehab services back up from down the hill back up here, and about 2/3 of the clinic will be able to move into their new space just after phase one. So that's pretty exciting.
Yeah, and we'll continue to post updates on the website, on Facebook, social media, so we'll get those out there to people. So moving away from construction,
Yep.
Let's talk a little bit about providers, because we've had a couple of people who've left in the past year.
Yeah.
Dr. Ingram and Lori Johansson both retired. But now we've got some new people coming on board, so let's talk about that.
Yeah, we're super excited to have 2 new family medicine physicians and also a general surgeon that will be coming after the first of the year. So Dr. Evelina Todd will start on Monday, January 6th. She'll start seeing patients on the Tuesday. I'll keep her busy on day one with a little orientation, but she really wants to hit the ground running. This young lady is very talented, and she will do a very good job with our community and especially chronic care and acute illnesses and things, and she'll do very well for us. And then also starting, I think it's February 3rd, Dr. Kamari will be coming and starting her practice here with us as well. She's also a family medicine physician, and she also is very talented and has some history for family medicine out east, and so she'll be coming to our area where it's probably a lot better cultural fit for her, so that's exciting. And then starting March 1st, we will have a new general surgeon starting, Dr. Malazik. He's coming from Nebraska, out in, I believe, western Nebraska, and he will be starting here on March 1st, and he will be joining Dr. David Wright to complete our general surgery team that we'll have. And so this gentleman has a history in the military, plus, lots of extensive general surgery experience, and we're just really excited for these new providers. We also had Kylie Martin that started in November, and so she is a family medicine nurse practitioner, and so she's doing really well, and we still have a lot of our providers that we've had here for quite a while, so yeah, it'll be great. It's awesome.
Yeah, and for those people who would have an interest, you can go online, request an appointment, or you can call us here at the clinic at 712-265-2700. And you can schedule your appointments. My guest on the podcast today is Erin Muck, President and CEO of Crawford County Memorial Hospital. We're getting an update on things that are happening in and around the hospital. One thing that we embarked on last year, the end of June, was a new electronic medical record, a requirement under federal rules and regulations. And we went away from 2 systems so we could go to 1. And part of the deal was that we were going to be able to get a much better patient portal, and I think we finally have gotten some of that worked out as well.
Yeah. So we're 6 months in, which is great, and your patient portal is only as good as the information that's put into it. So now that we've got 6 months worth of data, when you're seen here, please, they will give you information and how to get logged into the patient portal. If you struggle with that, please reach out to us so we can help you get on. I've gotten some really good feedback about the information that you can see on the patient portal. You'll be able to look at your lab work and your visits. And I just think it's a lot more robust patient portal. Before it was only for the hospital side, so things that happen in the clinic you couldn't see on our patient portal. So now it's all encompassing. So if you're seen in the ER, if you're an inpatient, an outpatient, or in the clinic, all of that is available on the patient portal now. So that's pretty exciting. So I think that 6 months in, we've done a nice job working out some bugs with our EMR. There is no EMR implementation that goes completely smoothly. And I just think our staff here has done a beautiful job navigating some of those bumps, and we are so appreciative of our community putting up with our learning curve. So, and I think they've actually been way more generous with their patience with us than I think we deserve. So I appreciate that.
You know, notwithstanding everything else that's been going on, construction providers, EMR, we also have had a major upgrade in our radiology department with a new CT scanner.
Gosh. Oh, yeah.
So that was about a 4-week process, maybe a little bit longer than that, but we're not allowed to not continue to make those improvements in the equipment that we have, especially the diagnostic equipment that we have. So maybe just a really brief background and comment on the new CT scanner.
So, any equipment that you purchase, there's usually an end of life where software is not supported, all of those things. And so our CT scanner was getting to the point where it was going to need to be replaced eventually. And so we like to be proactive about those things. So our board is always very mindful of that and had approved on our budget, our budget for this year to replace our CT scanner. And when we looked at that, we decided, do we get similar to what we have, or do we get something a little bit better, and knowing that it would grow with us into the future. And so previously we had a 64 slice CT scanner, and that is very good. It's standard of care, it's great. But we decided to go with a 128 slice CT scanner. This will allow obviously better pictures. But it'll allow us in the future to be able to do further testing that we hadn't been able to offer here before. Obviously, it'll take some time for us to learn and get things set up, but it'll definitely be. But I do think that our new CT scanner the radiology staff is loving using it. The pictures that we get from it are amazing. And so we're just really, really grateful for the board's support and always making sure that we have the best technology to do our job and to serve our community and just giving quality care.
My guest on the podcast today is Erin Muck. Erin is President and CEO of Crawford County Memorial Hospital. We're taking a look back at 2024 and a look ahead into 2025. And I know that there are some things that are almost immediately on the schedule that are going to be coming up here pretty quick. One of them obviously is property taxes and coming up with a budget for the next fiscal year. People don't, to a certain extent, I think people realize that we're budgeting about 18 months out from the end of the following fiscal year. So we start right now budgeting for fiscal year 26, which will end in June of next year, in June of 2026. So let's talk a little bit about budget. Let's talk a little bit about ambulance, because we know that we've got an upgrade coming there, and maybe some other things that we've got out there that in the future that we're taking a look at.
Yeah. Whenever we do the budget for the future, which is, your fortune telling is essentially what you're doing. So it's hit and miss, and you don't always anticipate things like pandemics and changes that insurance companies will do and not give you much notification that it's going to happen, or drug costs going up, or supply costs and those kind of things. So all of those things we have to take and guess that may or may not happen into the future, and when we're developing that budget. And part of that is we do receive taxes for running, not necessarily for operations. And really, we only levy for taxes for our ambulance service that we have here. And just as an FYI, our ambulance, yes, we can bill for it. Reimbursement for ambulance runs and 911s and transfers are not reimbursed well at all. And in fact, we end up with a deficit. It doesn't break even. And so, part of that levying of taxes actually covers the cost of the ambulance service that isn't made up by revenues. And then the other piece of that is also our benefits, some of our benefits, and that is the IPERS that we are required to provide for our staff, so the Iowa Public Employee Retirement System. And so that is a part of the budgeting process, is really looking at, the board has to look at that and determine, what does that look like? Do we decrease the amount that they're levying for taxes? Is it, we're in a bad place where we need to increase it, and those kind of things. And they've got to take a lot of that information out there. What's happening legislatively, what's happening with insurance companies, what's happening with supply costs. And just, as a, maybe people don't know that out in the community, healthcare wise. Before the pandemic, a box or a case of gloves used to be about $80, and now it's over $300 for a case of gloves. And so obviously we go through a lot of those, but I think as an example, I don't think people realize how much the increase of supply costs and drug costs that happen in healthcare, and it's making it very difficult to always make ends meet. Which I would say is that I'm very proud of us that we have always looked at how we can do things in the most lean way, and how we can save money elsewhere, knowing that we're spending money more over here. And I do think we do a nice job with our budget, even though it is a guessing game.
And I think maybe one of the examples that people who are listening today can really identify with is our property taxes are also used to cover our insurance costs, our property casualty malpractice insurance
Correct.
Costs. Most homeowners, anybody who owns a vehicle, anybody who drives a car or a truck or an SUV or whatever, they've seen a significant amount of increase in insurance costs, and we're in the same boat with everybody else. We end up having to pay those same increased costs.
Yeah, I mean, anytime that there is a derecho, like we all get dinged with that, even though maybe it didn't affect us. So those tornadoes in Iowa this last year, we're all feeling it, like even at our homes, but we feel it a lot here at the hospital as well. And then when we talk about malpractice insurance, we have to have insurance for the care that we're giving here, obviously. And in the time that I've been here, it's more than quadrupled. And, what happens is they had large payouts out, in Eastern Iowa, there was like a $98 million judgment. There was an $80 million north of here. There was like almost a $30 million one in the Des Moines area. And all of that gets filtered out through the rest of us. And so all of our costs go up, whether you had lawsuits or not. And so we've all seen that. And so that is a big deal. And so our legislators worked with us, and they were able to pass tort reform. And we do feel like those costs will go down over time. And so that's a great thing. It's just, it'll take time for that to happen.
And yet, in talking about all the property tax issues that we've discussed today, it's still only 5% of our overall budget. 95% of the revenues that we receive are from patient care, and those are the revenues that actually pay for the vast lion's share of all the expenses here at CCMH.
Right. The schools are utmost important, so is our city and county, but they're 100% tax funded, where we're only like 5%, sometimes we're less than 5% tax funded. So I don't think people always realize that, but I feel like I'm willing to pay whatever it is on my taxes to know that the ambulance is going to come and show up and pick me up when I'm having my heart attack.
So just in the few seconds that we have left, I want to just offer you the opportunity, if there's something that we've missed today or something that you have coming up, or if there's just one particular thing you'd like to focus on for just a second.
You know, I just think we're really excited about our new providers coming. They are, you know, our providers are amazing here, and it's great to find some really good, talented providers to come and join our medical staff and complete it. I think that we're very lucky about that. I do know that there's physician shortage out there, so I'm very grateful to our community to help attract those providers. I do feel like you know, we need to make sure that we have clinic appointments available, you know, when people are calling in. And so this is part of that building to make sure that when you call in that you can get a same day appointment for your acute visit. So that will be a big focus as soon as we get both of these providers on board. So see that coming and know that we'll always be here for you, and we're excited for the year. I mean, I think we're going to have another busy year.
Yeah.
It was wild last year, and it's going to be wild again. I can't wait.
It'll be a great 2025, Erin.
Yeah.
Thank you for joining me today.
Yeah, thank you.
My guest on the podcast today, Erin Muck. Erin is the President and CEO of Crawford County Memorial Hospital. I'm Don Linsman, your host for the Here's to Your Health podcast. Thank you for joining us today. Have a great day.